Good day, everyone. No, before I proceed with my short talk, let me just introduce myself formally. No, I am Dr. Ariel Baira. I am a licensed medical doctor. I've been practicing medicine for almost 40 years now. No, and my specialization is really in obstetrics and gynecology. Uh, Ang pinakahuling hospital na pinasukan ko ay sa Asian Hospital and Medical Center, where I stayed there for 18 years. Okay. Aside from that, of course, I've been doing a lot of clinics in different parts of Metro Manila. And at the same time, of course, I am also connected with some companies, offering different supplementations. I've been doing this product forum for probably more than 10 years now. And I've been to, I've been all around the Philippines, not only in the Philippines, but also, of course, in other parts of the world. In fact, I just came from Malaysia, no, less than a week ago. And about a month ago, I was also in Japan, no, Sapporo, Japan. Uh, I am constantly training for different newly discovered supplementation. No? The reason why I am here promoting different products, and most of them are what we call organic and natural products, is because I believe in the power of these products. No? I try to deviate, no? Binabago ko yung sistema ng tinatawag nating mainstream medicine, no? Hindi na yung symptoms lang yung tinitreat, but we go deeper to the main root to discover and identify the main cause of diseases. And at the same time, I am also very particular in preventive healthcare. Nung bata tayo, lahat tayo nung nagdaan sa very common saying na an ounce of prevention is better than a pound of cure. Pero hindi natin nabigyan ng importansya. And admittedly, kahit ngayon, no, now that I'm doing this, no, we are now deviating. We're now focusing more on trying to prevent, no, the different diseases that might affect our overall health. So, pinalalakas natin. In short, pinalalakas natin yung ating katawan. Humahanap tayo ng iba't ibang paraan, no, para nung sa ganun matugunan yung mga bagay na makakaiwas tayo doon sa mga sakit na maaring magresulta sa hindi magandang pangyayari. No? So, ngayon, as I talk, no, as I speak right now, the focus of the entire world, no? Kasi ito recently last week, I just came last Monday, no, from Malaysia, and a month ago I was in Japan, and the convention that I attended were all geared towards what? No? Trying to find ways and means on paano natin mapapahaba yung buhay natin. So, ang labanan ngayon is pahaba na ng buhay. No? And one of them, of course, is stem cell treatment. I am very much involved in stem cell treatment. No? And, of course, I still believe in so many of these products, no? Mga supplements na tutulong sa ating pang-araw-araw na pamumuhay. So, the competition right now of all human beings is longevity. Paano natin mapapahaba yung buhay natin? No, hindi naman tayo pwedeng humingi lang ng awa sa Panginoon. We need to do our part. No, sabi nga, may kasabihan na sa Diyos ang awa, nasa tao ang gawa. So precisely, we need to do something to make sure that we are able to address all these medical concerns and issues. Okay, so having said that, no, I hope everyone would realize the reason why I'm here is to talk about our product in DCS International. And one of the major products of DCS International is, of course, Yuba Ursi. No? Yung Yuba Ursi is also what we call the arctostaphylos. No? And our Yuba Ursi is being promoted as Yuba Ursi Plus because it contains several no, active ingredients that make up no, the product itself, Yuba Ursi. So, ano ba yung Yuba Ursi? Yuba Ursi remains one of the most important no, and commonly used urinary tract disinfectants in modern herbal medicine. No? Ang dami-daming studies about Yuba Ursi no? That is being focused on trying to treat, trying to prevent, no? Trying to shorten the course of urinary tract infections. No? Being in gynecology for so long a time, isa sa pinakamalimit na nagiging problema ng kababaihan is of course urinary tract infection, UTI. Doc, meron ako UTI, Doc, and all this. Okay, so this is our product, no? Yuba Ursi. Okay, I hope everyone sees this. Ito yung ating produktong Yuba Ursi Plus. Okay, so this is napakagandang supplement because as I go over all the research materials that I came up with, no, maintindihan natin as we go along ano yung mga beneficial effects ng ating produkto. No? Kasi napakahalaga. Right now, the promotion of different supplements is very competitive. So it's but natural for us to think no, and give emphasis on the quality of the products that we use. No? And the quality of the products that we use will always depend on the active ingredients that are incorporated into each product. No? So sabi nga natin, this Yuba Ursi Plus is widely used in the treatment of both complicated and uncomplicated acute and recurrent urinary tract infections. No? Yuba Ursi is also commonly called kinikinik. No? It means common bearberry in the US, Europe, and other countries. It's very popular among patients suffering from any form of urinary tract infections and any related kidney problems. Okay, it contains what we call tannins. Ano ba yung mga tannins? These are biochemical compounds, no? Na mayroon tinatawag na astringent effect. Ano ba yung astringent effect? It helps, no, in trying to tighten, no, yung mga tinatawag natin mucous membranes in order to reduce inflammation and to fight infection. So pag sinabi nating reduce inflammation and fight infection, it is an anti-inflammatory product. Bakit napakahalagang malaman or maintindihan natin pag pinag-uusapan yung anti-inflammatory health benefit ng isang produkto? Lahat ng sakit ng tao nagsisimula sa inflammation. No? Kaya nga yung paggamit ng mga medical terms na merong itis, no? Means may inflammation. And the moment we are not able to control the inflammation, then it becomes a disease entity. Nagiging sakit na. Kaya ano yung mga sample? Pharyngitis, tonsillitis, bronchitis, di ba? Cervicitis, cystitis, lahat yung may itis na yan, na iba't ibang sakit, nagsisimula sa inflammatory. Ano yung inflammatory reaction? Pamamaga ng organ or ng part involved. So, being an anti-inflammatory, dun pa lang, sa puntong yon, malaki na ang tulong na magagawa ng ating UVC. It also contains natural chemicals. Kasi we have to emphasize na natural chemicals. Kasi baka sabihin ng iba, Doc, ano ba yan? Synthetic ba yan? Kasi may chemicals. Natural chemicals called glycosides. Specifically, yung tinatawag nating arbutin that are transformed and metabolized into what we call hydroquinones to prevent melanin formation. Ano ba yung melanin formation? Yung nagbibigay ng ating dark color sa skin natin. Okay? Yun yung melanin production na tinatawag. Now, tayo mga Pilipino, no, and probably most Asians would prefer a lighter, no, skin color. Not realizing na kaya tayo binigyan ng Panginoon ng a little bit dark color because of the melanin production is to protect us from developing future skin cancer. Kaya hindi natin maririnig na mayroong Pilipino, perhaps even some Asian countries, na nagkakaroon ng skin cancer. Ang skin cancer ay malimit nakikita sa mga Caucasians, yung mga puti. No, lalong-lalo na when they try to expose themselves to sunlight. Diba? Nagsa-sunbathing pa yung mga yan. So tayo, dapat maging matuwa tayo because of the melanin production, okay, or formation. UVOC can help lighten a little of this, meaning it can reduce the production of melanin. But not to a point where baka mamaya magkaroon tayo ng problema sa ating skin, like skin cancer. Okay? UVOC also reduces uric acid levels. Importante yan. No? In order to prevent what we call gouty arthritis. Isa yan sa pinaka nagiging problema, no? Especially habang tumatanda ang tao, no? Laging may arthritis, hindi makalakad na maayos, no? Nahihirapan, may tendency umupo na lang, mahiga na lang. Kasi pagka gumalaw ako, kumilos ako, no? I can feel the pain, and the pain is so much, no? Yan yung tinatawag ng gouty arthritis. Sometimes yung mga knuckles, yung mga buto-buto natin dito sa ating mga daliri, namamaga, no, sa ating paa namamaga because of the accumulation of uric acid crystals. And of course, aside from that, is ang mas nakakatakot yung kidney stones. No, makikita natin ngayon, even in those conventions that I attended, no, yung CKD, chronic kidney disease, is rampant. Napakaraming merong chronic kidney disease. Dito lang sa Pilipinas, ang daming chronic kidney disease, no? That will necessitate, dialysis. Ang dami-daming dinadialysis yung araw. Ang isang, if I can remember sa mga articles na inilabas, in the 70s, okay, ang isang session ng dialysis, hemodialysis, would cost about 12 to 15,000 pesos. Bakit? Law of supply and demand. Kukunti pa yung meron. So, mataas yung presyo. Pero ngayon, sa dami ng dialysis center, kasi ang dami-daming tao na may kidney disease, hanggang 3,000 pesos per session, pwede na tayong makakuha. So, what does that mean? No? Ang dami kasi mga pasyente na nangangailangan ng dialysis. And one of them is bumibigay na, no? Hindi na makapag the functions of the kidneys are compromised. Ibig sabihin, hindi naman niya makayanan to the point na kailangan tulungan na ng hemodialysis. Okay, UVOC is also a powerful diuretic. Ano ibig sabihin ng diuretic? Yun yung nag-i-induce para tayo umihi. In fact, one of the standard treatments sa hypertension, sa high blood pressure, is a diuretic. Bakit? The moment na induce, no, yung ating pag-ihi, tumutulong siya para bumaba yung ating blood pressure. So, ang maganda sa uva ursi, it also has that what we call diuretic effect. No? Bukod sa iihi tayo ng marami para makaiwas sa tinatawag na edema, yung minamanas, di ba? No? Kaya isa sa mga gamot na ginagamit standard kapag ka minamanas tayo is a diuretic. Because bakit minamanas? Hindi nakakalabas yung fluids na dapat lumabas sa ating katawan. So by taking a diuretic, what happens? Nai-induce. Mas maraming ihi lumalabas, so the fluid that accumulates in the foot will definitely disappear. Mawawala na. So yung uva-ursi is a very powerful diuretic. So indirectly, tumutulong siya para mapababa din yung ating blood pressure. Of course, it has been found out na bukod sa pag-ihi, it is also has a good laxative effect. Ano yun? No? Para tayong madumi. Okay? Tumutulong din siya para mapalambot yung ating dumi para na sa ganun mas mabilis ilabas. Because constipation can possibly lead to serious gastrointestinal tract infections and serious complications. No? Ako nga, laging ko siya, because my dad died at the age of 56 years old. Napakabata. He was a victim of colon cancer. Okay? And, of course, sa mga libro na lumalabas, nakikita natin ngayon na isa sa mga dahilan pala ay hindi maganda yung bowel movement. No? Nagko-constipate. Kaya ako, whenever I give talks, I always try to tell my audience na napakahalaga na dumudumi ang tao. Hindi nga sapat yung minsan lang sa isang araw. We need to move our bowels 2 or 3 times a day. Kaya in my case, since yung tatay ko namatay sa colon, napaka-conscious ko niyan. Masama pa loob ko pagka 2 beses na ako dumumi sa isang araw. Okay? Now, remember, kahit pa kayo 5 hanggang 10 beses dumumi, for as long as solids yung ilinalabas nyo, that is not considered diarrhea. Diarrhea lang kapag ka tubig na, watery na yung lumalabas. Okay? Naturally, kung malakas tayo kumain, dapat marami rin tayo dinudumi. No? Hindi maganda kung ang dami mong kinakain araw-araw, tapos kukunti lang yung dinudumi. That is also a form of detoxification. Detoxification is now getting to be a byword. Ano ibig sabihin? Pinag-uusapan lagi. No? Yung detox. Detox means to remove the toxins inside your body. Especially yung tinatawag na heavy metal toxins. Ano yan? Lead, mercury, cadmium, arsenic sa mga gadgets natin, nakukuha natin. Sa mga isda, na minsan nakakakuha sila ng mercury, nakakain sila, kakainin naman natin sila. Ang mercury hindi natutunaw even in boiling water. So it will transfer to us. The moment we ingest them, there's a possibility that this will initiate carcinogenic transformation. Ibig sabihin, may posibilidad magkaroon tayo ng cancer. Okay, lead can also, ang dami lang. Kaya nga, di ba, sa gasolina, tinanggal na yung unleaded gasoline. But despite that, ano pa yung mga sources of lead? Plastics. No? Yung mga toys ng mga bata. Nakita sa mga pag-aaral, mga environmentalists, maraming lead content. Kaya nga sa hospital, tinanggal na yung thermometer, di ba? Nung araw, makita mo, nasa dulo, may mercury. Bawal na yun. No, hindi na ginagamit. Yung sphygmomanometer, yung BP apparatus, nung araw, ang ginagamit namin, yung desktop ang tawag doon. No? Pagka binomba mo ganun, tumataas yung mercury yun. Bawal na rin yun. So, binabawasan na natin. But the point is, sometimes by accident, pumapasok pa rin sa katawan natin. So, this detoxification, the form of regular bowel movement is very important. And that is one of the health benefits that we get out of uva-ursi. Now, ano pa? Sa respiratory problems. Uva-ursi has been found to address breathing problems like asthma. Asthma is a form of allergic reaction, no? COPD, no? Yan yung mga emphysema, bronchitis, no? Yan yung tinatawag na chronic obstructive pulmonary disease, COPD. And anong purpose ng uva-ursi, no? Because of its detoxification effect, nakikleanse din niya yung ating lungs. And in so doing, mapiprevent yung mga respiratory problems. It also improves the function of the prostate gland. Isa sa pinakamalaking problema nating mga kalalakihan as we mature. No? Kung sabihin we get older. As we mature is yung prostate natin namamaga, yung BPH, benign prostatic hyperplasia or hypertrophy. No? Hindi naman ibig sabihin na may BPH ka may cancer of the prostate. Those are two different things. But the mere fact na magkaroon ka ng BPH na aapektuhan din yung dami ng ihi na lumalabas. Kasi yung ihi natin magmula sa urinary bladder, sa pantog natin, bago siya lumabas sa ating ari, dadaan yun dun sa parang kanal ng prostate gland. So kapag ka barado or makipot na yung kanal na dadaanan sa prostate gland, naturally, kukunti lang yung ihi lumalabas. So ang feeling nung tao, ihi ng ihi. Do kay ihi ko lang, maya ihi na naman ako. No? Kasi konti-konti lang yung lumalabas. Ang daling naiipon yung ihi sa pantog. No? So that is also an indirect health benefit that we get out of uva-ursi. It also prevents hyperacidity and consequently, of course, peptic ulcer. Ano ibig sabihin? Because it has an alkalinizing effect. Mamaya kasi pag-uusapan natin ano ba yung contents ng ating uva-ursi. Why am I saying all these health benefits? Mamaya pag-uusapan natin. So it has an alkalinizing effect. When we say alkalinizing effect, it will try to neutralize the acidity of the stomach. Okay? Kasi isa sa malaking problema rin natin is hyperacidity. No? Acid reflux. Yung GERD, gastroesophageal reflux disease. Kaya ngayon, meron na rin tayong tinatawag na stress ulcer. Because stress leads to different medical conditions. Now, sasabihin naman natin, Doc, stress ako. Lagi ko nga sinasabi sa pasyente, wala naman taong hindi na-stress kung nga yung mga bata na may mga assignment na, may mga quizzes na, na-stress na sila. Tayo pa kaya na naghahanap buhay, gusto nating maayos yung ating mga pamilya. Of course, we are in a constant form of stress. No? Ako, kakagama sa pasyente, is po, okay kaya yung mga pasyente ko and all. Very stressful ang buhay natin. But we need to be able to manage stress. And one of them is by addressing problems of hyperacidity. Okay, so sabi natin diuretic, astringent, no? So it has something to do with trying to give glow on the skin. Pinagaganda niya yung natin ng skin natin, no? Muscle relaxant, importante rin yan. No? Kasi bakit? Yung muscles natin, if they are constantly in a stressful situation, ano nangyayari? Nagko-contract to the point na we will feel a lot of pain. No? Delikado pati yun. Dahil ang puso natin is an example of a muscular organ. So pag nag-tetanic contraction yan, delikado yung buhay natin. Because that will affect the blood flow. And consequently, the delivery of oxygen. Okay? Isa pa sa magandang health benefit ng uva-ursi is its antimicrobial property. Pag siya mo antimicrobial, antibacterial siya, antiviral, antifungal, lahat ng klase ng mikrobyo kaya niyang bigyan ng tulong para sa ganun hindi lumala. Now, just like any berries, kasi when we talk of berries, alam naman natin na napakaganda ng epekto ng different types of berries. You can say and enumerate so many of these types of berries, and all of them have significant health benefit. Now, sa uva-ursi, it contains high vitamin C levels. before the pandemic, I was involved heavily on vitamin C supplementation. Nung nag-pandemic, sino ba ang bida? Vitamin C pa rin. No? Bakit? Because nakita niya na maganda ang vitamin C as an antioxidant preparation. That's the reason why we stock so vitamin C preparations. Ang dami-dami, Umataw na ng gusto ang mga vitamin C preparations. And UVOC has a vitamin C content in its ingredient. So, taking regular vitamin C preparations would also prevent us from having what we call respiratory problems. Kaya siya naging sikat during the pandemic because COVID is primarily a respiratory infection. So, nakatulong siya ng malaki. And we also use vitamin C then as a protective supplement para mapataas yung ating immune system. And by making sure that our immune system is high, then we can at least defend our bodies from the possible invasion of these respiratory problems or respiratory pathogens, most specifically COVID. Now, vitamin C being one of the antioxidants contained in UVOC has so many benefits. Alam naman natin yan. It's very inevitable kahit sa mga bata. It's always being used. Now, it also has a soothing effect on trying to prevent muscle cramp. Minsan, di ba, parang pakiramdam natin, parang yung sikmura natin, in-squeeze, parang nahihirapan tayo. Because of what we call hyperperistalsis. Ang description sa medicine nun is yung tinatawag na burburigmi. Parang kumukulo yung ating sikmura to the point na parang minsan nagka-cramps Diba? Alam niyo ba yun? Ang hirap i-describe, pero nangyayari din yun. Na parang pinipiga yung sikmura mo. And UVOC has been found to alleviate these or prevent these stomach cramps na tinatawag. Okay? Now, yung antibacterial effect niya. Bakit maganda sa sikmura natin? Because it is directed specifically on two of the most common bacteria that cause diarrhea. And these are Shigella and E. coli. Yan yung mga mikrobyo na nakikita pagka in-examine ang dumi natin kapag tayo ay nagtatae. So, ano ang magandang epekto ng UVOC? Because of its antibacterial effect, pinapatay niya itong mga bakteryang ito para na sa ganun, hindi na lumala yung ating pagtatae or diarrhea. Now, kanina nasabi ko yan, UVOC can lower the blood pressure through its diuretic effect. It also relaxes the major blood vessels of the gastrointestinal the cardiovascular system. So, dinadilate, binubukan niya yung mga ugat na gustong kumipot. So, pag pinabukan niya, that will allow more blood flow. And the more blood flow it makes, then mas maganda ang delivery ng oxygen. And consequently, that will bring a lowering of your blood pressure. Okay, so diuretics, sabi nga natin, bukod sa aside from inducing yung ating pag-ihi, it has a very powerful effect on what we call congestive heart failure. Isa sa ikinamamatay ng tao is the moment they develop congestive heart failure, kung saan nahihirapan na yung puso tumibok. Kasi ano nangyayari? Minsan unti-unti lumalaki. So the moment magkaroon ng enlargement of the heart, cardiomegaly tawag, mas madali na siya. Para din tao, kapag ka ikaw ay obese, chances are mas madali kang mapagod, hindi ka makatakbo or makalakad ng maayos. compared to someone who is not obese. Ganun din ang puso natin. Because of cardiomegaly, because of the enlarged musculature of the heart, madali na siya mapapagod. So, unti-unti siyang humihina. And that is what we call congestive heart failure. To the point na mapapagod na siya talaga, hindi na niya kakayaning mag-pump at tuloy na titigil na, and what happens next would be, of course, inevitable death. Mamatay tayo at the moment. Nakikita nga natin yun sa mga teleserye. Makikita mo yung ECG, yung ganda. Nung una, maya-maya, straight line na. Which means, wala na, patay na. Tumigil na yung tibok ng puso, so naturally, the patient dies. Now, UVOC also contains allantoin. Ano ba yung allantoin? Ito yung ginagamit, ito yung ingredient na isinasama sa maraming skin creams, no? Or ointment, pampaganda. No? Not only sa pampaganda, but also to relieve irritation and protect even in minor cuts, so scratch, burns. No? Pwede mong ipahid. No? So, pwede tayong experiment. Kunin natin yung ating oral, pisain mo, and then you try to place it. Kung meron kang sugat or whatever, that will definitely help. Now, meron tayong tinatawag na MUSH. Ano yung MUSH UVOC? Yung sa Tagalog yan. Yun parang hindi naman tinunaw, kundi linamas mo. No? And the moment you apply that on wounds, because of its antimicrobial effect, what happens? No? That will prevent you from getting infection. Kasi kapag may sugat tayo, numero unong concern natin is to avoid infection. Kasi pagka na-infectionan yung ating sugat, chances are kakalat yan sa ating katawan. Okay? It also can be applied externally for skin rashes and muscle strains. Now, what is good with our UVOC is orally taken. So, mas wider and broader yung tinatawag na beneficial effect niya. Kasi the moment i-tinake natin yan, lahat naman, hindi naman ibig sabihin, tinake natin yan, dun lang sa ating sikmura ang magiging epekto. It goes into the bloodstream. The moment it gets into the bloodstream, sa dugo natin, overall, lahat yan, magagawa niya. Now, it also can prevent early aging signs, yung pagtanda natin, like wrinkles. No? Kaya ngayon, ang dami-dami ng tinatawag na Beauty and Wellness Presentation, BWP. Nung una sabi ko, ano ba yung BWP? Yung pala, Beauty and Wellness Presentation. Because in women, napakalaga yung beauty. It's something na, of course, debatable, pero sila kasi na-appreciate nila kasi nakikita nila from outside. What's happening inside our bodies, minsan medyo nagdududa ka pa. Hindi ko naman nakikita eh. No? So, anong magiging batayan mo para sabihin na you're getting healthier, you're getting more energized and all. Well, of course, the activities that you do, yung routines na ginagawa mo. Pero, yung external effect, kitang-kita mo kagad. Uy, nawala na yung wrinkles mo, nawala na yung tinatawag na crow's feet dito. No? Yung wrinkles mo sa forehead, sa nababawasan. So, that has been also been associated with UVOC natin because of its high antioxidant property, astringent, and anti-inflammatory effects. No? Kasi ano nangyayari? Kalimitan, kaya tayo nagkakaroon ng wrinkled skin or wrinkles all over the body, hindi lang sa face, pati sa kamay, sa paa, and all of this. Because sometimes they are also caused by what we call micro-inflammations. No? Mga maliit na inflammatory reaction because of the presence of free radicals. Kaya nga, di ba, whenever we talk of antioxidants, we always associate it with the amount of free radicals that we need to eliminate or kill. No? Kasi exposed tayo sa environment, sa kinakain natin, kung saan-saan. So we get all these toxins na sometimes, in most cases, not sometimes, hindi natin alam na nandoon na pala sa loob ng katawan natin. And the moment we're not able to get rid of them, to remove them, ano mangyayari? Yan ang magiging cause ng ating sakit. So the antioxidant, astringent, and anti-inflammatory effects would definitely have an impact on all these different microinflammations, thus resulting to wrinkle-free skin. Ibig sabihin, maganda yung atin. Siyempre, sino naman sabihin, di ba, minsan, you tend to say your real age. Kasi pag sabi, uy, 50 ka na? Parang mukha ka ng 30. Oh, di ba? Hindi, 50 ka na? Hindi, parang mukha ka lang 49. So, di ba? So, sometimes, napakalaki. In fact, in the company that I work with, not European Wallet, where I am the medical director, meron kaming test. We call it the biomed scan or biological body scan. At the end of the test, we're able to determine, kino-compare namin yung chronologic age ng pasyente based on the date of birth. Unfortunately, increase pataas ng pataas yun every year, nadadagdagan. No? Versus your biological age. Ano yung biological age? That's the age of your cells. And pwede natin i-modify yun. Meaning, pwede natin siyang pababain. But unfortunately, kalimitan, majority nung nagpapatest ng gano'n, no? Mas matanda pa yung kanilang biological age sa chronological age. Minsan 10 years, 15 years. Parang nakakanya naman. Ano ibig sabihin? Napapabayaan na yung katawan nila. No? So you need to do a lot of procedures that will try to reverse the aging. Kasi ngayon, ang laban na anti-aging. Reverse aging. That's what we call bioregenerative medicine. And I am also involved in that aspect. Okay? Now, UVOC can strengthen hair follicles then. No? Thus preventing hair fall. Kasi maraming problema sa buhok. No? Sa shampoo ka, pagkatapos maligo, makita mo dahil buhok na nalalagas. We shed normally about 150 strands of hair. But there are people na, sa atin, yung gano'n, hindi natin napapansin. But yung iba, sa sobrang dami, napapansin mo, nilalagas. No? Importante yung hair follicles kung saan doon tutubo yung ating buhok. So, ang purpose ng UVOC, this can strengthen. Mapapatigas niya. No? Kaya nga, di ba, ibang mga propaganda ng shampoo, sinasabunutan pa nila sarili. Kunyari, just to show the strength of their hair. Ito, natural. We go by natural and organic preparations. Ayaw natin siyempre na synthetic. Because as time goes by, habang tumatagal yung paggagamot mo o paggamit mo ng mga synthetic preparations, what usually happens is that, eto na, sisipa na yung mga tinatawag nating side effects. And these side effects may also bring about serious medical complications. Okay. So, UVOC can be used to eradicate any vaginal infection. Okay, so because of its antimicrobial and anti-inflammatory effects. So, it will prevent you from getting into, the ordinary vaginal infections. No? Even as far back as when we say STD. No? Yung mga sexually transmitted diseases, huwag lang malala. Naturally, we still have to take the necessary standard medication. But what we're trying to say is UVOC will prevent you from getting, most of these STD diseases. Now, the extracts from UVOC leaves contain many protective causes. Ito na. No, yung mga mahalaga. Because if we try to decipher, if we try to dig deeper into the properties and ingredients of the product, dito natin nakikita. Ano yun? Flavonoids. No? Flavonoids is getting to be a very popular ingredient. Bakit? Because of its impact on cancer. Kaya nga siya kinoconsider ngayon anti-carcinogenic ingredient. No? Because isa sa major concerns natin is of course cancer. Sabi nga, magkasakit ka na ng ibang sakit, wag lang cancer. Now, of course, it's not something hopeless because ang importante doon is the moment ma-detect natin yung cancer in its early form, then we can almost guarantee a complete cure. Pero, kung hihintayin natin magkaroon tayo ng simptoma, kung hihintayin natin makalala, tsaka lang tayo magpapacheck up or magpapatingin sa doktor, nakita o stage 4 na yan. No? Kumalat na sa ibang parte ng katawan, mahihirapan na tayo. That's the reason why we also cultivate the idea na early detection will definitely result to better outcome. So again, preventive na naman. Walang pwedeng mag-question if we talk by preventive measures. No? Iridoids. Ano yon? It's similar to flavonoids, no? Ano siya? May neuroprotective. It means it helps protect our brain. May hepatoprotective. It helps protect our liver. And meron din siyang anti-tumor properties. So, again, napakaganda na. Hydroquinone glycosides, mainly arbutin, sabi nga natin, because this will help reduce the melanin production. So, makakatulong para medyo mabawasan yung ating dark skin color. No? But remember, again, ayaw natin na sad time po. Well, of course, kaya sumikat ng glutathione. Doon pa sa side effect tayo concentrate. But not realizing that the primary purpose of taking glutathione preparations is what? It's being a master antioxidant. Mamaya, pupunta tayo dyan. And then, of course, tannins. Again, this is, kaya may tinatawag na anti-mutagenic. It means it will prevent us from getting into outright cancer. And of course, terpenoids, which are, again, anti-inflammatory, antimicrobial, and anti-carcinogenic. So, kung titingnan natin, no, yung protective constituency ng uva ursi, napakaganda. Because very broad yung kanyang effect. So, in most cases, it will be able to address most, if not all, of our major concerns with regards to different diseases. Okay? Next, some of the main uva-ursi benefits. So, kanina pa natin pinag-uusapan yan. So, it's just probably a sort of a emphasizing how important it is to take our uva-ursi product. So, number one, sabi nga natin, comes to kidney problems and urinary tract infection. No? Yung uva-ursi is most often used to help treat UTIs and bladder infection. Say bladder infection, that is cystitis. It can reduce the recurrent episodes of urinary tract infection. Kasi iba, ginamot mo. After, say, less than 1 month, eto na naman, may problema sa UTI. So, pabalik-balik. Now, when we take regular doses of uva-ursi, chances are it will prevent us from getting into any of these problems of urinary tract. Helps prevent UTIs, cystitis, swelling of the bladder, urethra, and all of this. This can also help reduce the bacteria that accumulates in the urethra and blood that lead to infection. Kasi the moment nakapasok yung mikrobyo, doon pa lang sa labasan ng ihi natin, that can migrate. Ibig sabihin, pwedeng pumunta sa kaloob-looban and eventually affect the entire kidneys. No? Now, it also helps manage what we call urinary incontinence. Ano ba yung urinary incontinence? Hindi natin mapigil pag-ihi. No? Naiihi ka na, hindi ka pa man lang nakakapasok sa comfort room, sa CR, lumalabas na yung ihi mo. No? Tapos ka na umihi, no? Gaano ka na, may lumalabas pa rin. No? So that is what we call the uncontrolled leakage of urine. No? So ano yung tulong na naibibigay ng uva-ursi natin? It will try to tighten and shrink the mucous membranes, no, that will help control the muscles of the urinary tract. Meron tayong tinatawag na detrusor muscle, no, sa loob ng ating urinary tract. And the moment that contracts, no, napipigil niya yung possibility na lalabas yung ihi. So UVOC will definitely stimulate the controlling effect of the detrusor muscle that will eventually help in trying to control yung urine leakage or urine output. Okay? UVOC combined with green tea, no, nakita natin, was able to lower Staphylococcus saprophyticus. No? Yan yung isa sa mga, kasi ang bawat infection, ang bawat mikrobyo, hindi lang isang klase. Wow, Staphylococcus, maraming klase pa rin yun. Streptococcus, maraming klase pa rin yun. So, lahat yan, kailangan natin na nabibigyan ng pansin. And UVOC is able to kill, no, these types of bacteria in order to balance, no, or restore in normal pH balance. Okay? It can also kill E. coli, isa sa pinakamalimit na dahilan ng infection, especially of the urinary tract, is E. coli, as well as yung digestive tract. Again, sabi natin, natural diuretic, no? So it also helps flush out the fluids from the body, no, in order to reduce, no, yung swelling, yung pamamaga. Sabi nga natin, lalong-lalo na yung manas, no? And that will get away by taking continuously, no, yung UVOC. What is good with taking natural and organic supplements, like for example, UVOC, is that you can take it for a long period of time. No? Hindi tayo dapat matakot, Doc, baka naman ako ma-overdose. Walang overdose na gano'n. No? In fact, it will even further provide the protection that we need the moment to start taking them on a regular daily basis. No? Okay? Reduce hyperpigmentation of the skin. Okay? Kasi minsan nagkakaroon ng parang batik-batik na rin yung ating yung ating balat, no? So that will, ano ang purpose ng UVOC, no? Lalo na kung if you try to put it, kaya lang natin explain as a topical preparation, meaning pinapahid, is because it will help reduce the pigmentation. So uniform yung kulay natin. Now, since we are taking it orally, sabi ko nga kanina, it will definitely have a more comprehensive and generalized effect. And that will also help in trying to lighten the skin. Its skin-enhancing effects are mostly attributed to its antioxidant content, no? Especially yung ating compound na arbutin. The reason why glutathione became popular for skin whitening is because of its antioxidant effect. In fact, dapat natin tandaan na ang glutathione is a master antioxidant. And in being so, naging consequence na rin yun yung pumuputi. Pero I don't say that to patients. Kasi minsan nag-expect, Doc, gusto kong kasing puti ng katulad ng ibang artista. No? Hindi naman yung pwede basta-basta mangyayari. It depends also on how you are able to metabolize the supplement and how your body reacts to it. Okay? So, yan yung ano. It also helps reduce breakouts. No? Alam niyo ba na sa mga studies na ginawa, yung mga millennials, lalo yung mga kababaihan, na maraming tigawat sa mukha, isa sa mga common cause nun, hormonal. No? Makikita mo, tanong mo dun kung meron kayong kilala. Marami, hindi ko naman sinasabi lahat. Marami sa kanila have irregular menstrual cycle. So meaning, yung hormone level nila is deficient, kulang. And that manifests through yan, yung mga acne, pimples, whatever. Doon sila lumalabas. Okay? Now, its skin-enhancing effects are mostly attributed, sabi natin to, antioxidant effect. And because of its cleansing effect, that will also prevent us from getting breakouts, acne, pimples, and some oiliness. Minsan, daming pakiramdam, dami-dami mong langis sa mukha. Especially when you're fond of taking a lot of fatty foods. Mga taba. Some other uses, no? Ano yan? Sabi natin, nabanggit natin kanina, it will try to prevent constipation and indigestion, which is very good. It will also prevent us from getting into painful and frequent urination, so urinary incontinence. No? It will try to eliminate, no? Or detox natin yung uric acid accumulation, no, sa atin para hindi mamaga yung ating mga knuckles, no, yung ating mga, no, and lead us to gouty arthritis, no. It will also prevent us from developing slow healing wounds. Kasi unang dapat isipin natin, bakit ang bagal gumaling yung ating sugat? One would be sugar. No? So pagka ikay diabetic, chances are mas matagal maghilang ng mga sugat. So that will also have an indirect effect. No? Damay-damay na yan eh. Kaya nga di ba, iba pag sobrang complications sa diabetes, pinuputol na yung paa. Because they're trying to prevent it from spreading throughout the body. So, below the imputation or above the amputation. Nabulok na eh. Wala na eh. Hindi na nabibigay ng blood supply. So, anything that is also related to inflammation, aches, pains, yung mga ganon, biglang sabihin merong namamaga sa loob. Of course, kidney infections, and even respiratory problems. Okay? Now, kaya tinawag na uva-ursi plus, hindi naman uva-ursi lang. Because it also contains spirulina, wheatgrass, okay, barley, moringa, insulin plant, and rosehip. So, kung titingnan natin, gaya na sinabi ko kanina sa umpisa, that our product, uva-ursi plus, is a very powerful product simply because marami siyang added ingredient. Hindi na tawag natin multi-component supplement. Hindi lang isa, kundi marami ingredients. No? And all of these ingredients have been, pinagsama-sama, have been combined, no? In order to allow an extra strength, no, in addressing the different health conditions. So like spirulina, ito yung blue-green algae, no? Very good source of protein, copper, and B vitamins. Ano yung health benefits ng spirulina? No? Heart health, because it has a vasodilating effect. No? Napapaluwang niya yung mga ugat na kumikipot, so it will try to smoothen, no, and allow more blood flow. And in so doing, that will definitely increase oxygen level na kailangan ng lahat ng cell na ating katawan. Gut health, this will prevent yung indigestion, possible constipation or regular bowel movement. No? That will also address problems of acid reflux or what we call hyperacidity problems. Cholesterol management. So it will try to increase the HDL, the good cholesterol level, and at the same time decrease or reduce the LDL or the bad cholesterol. Weight loss, because it will increase, spirulina has been found to increase the metabolic process of the body. So hindi, iba meron tayong tinatawag na natutulog yung taba. Meron ding natutulog din yung asukal sa ating katawan. And that is very bad. We need to utilize both the sugar and the fats in order to make sure that we don't go overweight or obese. Kasi sa America and in other countries, isa sa pinakamalaking problema nila is obesity. And in women, in their reproductive age group, sabihin yung mga pwede pang mga anak, nagiging problema yung PCOS, Polycystic Ovary Syndrome, that is associated to obesity. Makita mo, Dok, paano ako mabuntis? Ano ba ang problema? Hindi pa nasisimulan yung mga test. Nakita mo pa lang yung pasyente, isa na itong problema. Kasi obese yung pasyente. So part of the management in order to improve your capacity to, get pregnant is lower your weight. No? Kaya importante yung weight management na tinatawag. And then of course, reduce blood pressure. Because the moment you're able to dilate, pinanluluwang mo yung mga ugat na dinadalo ng dugo. And at the same time, binabawasan mo yung taba para hindi lumapot. Kasi pag lumalapot yung dugo, there is an increased tendency to develop what we call blood clot formation. At itong blood clot na to, pwedeng madala sa utak and that will result to stroke or brain attack. Or dito bumara sa puso, which will result to myocardial infarction or heart attack. Okay? So, napakaganda na, kaya nga, binubusisi natin ang gusto. Ano yung, bakit natin nasasabi na ganito? Simply because of the different ingredients that go with the product. Muscle strength, no? Prevents anemia, importante yan. No? And potential anti-carcinogenic property. Now, aside from spirulina, meron po tayong wheatgrass. This is known as the living food because it is also considered a super potent health food supplement. Superfood can eliminate toxins, no? Kasi meron siyang detoxifying effects, especially in the liver. The liver, remember, is a major detoxifying organ. So it can help in digestion, boost metabolism, meaning increase the metabolic rate of the patient para to be able to use yung sugar as a form of energy para hindi tumaas yung sugar sa ating dugo, no? That can result to diabetes mellitus. It will also increase the utilization of fats para nga to prevent yung paglabot ng dugo natin. No? Kasi bakit ba nangyayari ang mga yan? Simply because of the types of food that we eat. Masyadong matatamis, maraming carbohydrates, no? Masyadong mamantika, maraming taba. So lahat ito nagsasama. And we need to make sure that part and parcel of the entire gamot ng paggagamot is to also consider the nutritional side of things. Kasi kung hindi rin tayo mag-iingat sa mga kinakain natin, then chances are pabalik-balik na lang. It will be a vicious cycle. Now, it also boosts immune system. The immune system became a very popular term during the pandemic. Ano ba yung immune system? In short, body resistance. Yung resistensya ng katawan natin. The moment na bumaba yun, naturally, itong mga I call them mapagsamantala because these are called opportunistic microbes. All around us, nakapalibot yung mga mikrobyo. No? And kung mababa immune system natin, madali tayo papasukin ito. That will result most often than not yung mga respiratory diseases. Colds, kaya sinisipong ka, trangkaso, bronchitis, pneumonia. No? Pero pagka mataas ang level ng immune system natin, body resistance, chances are hindi sila makapasok. So that's very, very important. That's also the reason why during the pandemic, yung COVID, dami nahawa, dami hindi. Kasi yung exposure. Kung mababa yung resistensya natin dahil pagod tayo, we're not eating proper nutrition, and all of this, naturally, bababa. Puyat tayo. No? Pag bumaba yung pasok agad, yung mikrobyo. Okay? So one way of doing it is just to make sure that we are able to make sure that our immune system is high. That is by taking UVOC supplement. No? It can also provide the necessary energy. Importante yan eh. No? Lagi tayo may energy. In fact, meron akong test na ginagawa sa company to determine the amount of energy resource that you have. And at the same time, to determine the amount of energy that you spend. Kailangan mas malaki pa rin yung reserve natin kaysa doon sa ginagamit natin. Because kung baliktad yun, chances are, manghihina tayo. No? Madali tayong mapapagod because the energy level will definitely go down. And sabi nga natin, it lowers the blood sugar level. No? Kasi it increases the metabolic property. And very evidently, importante, helps with arthritis pain relief. Kasi yung sabi mo nga kanina, kapag kami kumikirot, no, lalo na kung gouty arthritis yan, no, chances are hindi ka makakilos, wala kang gana kumain, no, nawawalan ka ng pag-asa sa buhay. Kasi Dok, ano ba ito? Ang dami-dami may sakit. So, importante to address that problem. Another important ingredient, aside from spirulina and wheatgrass, is barley. Everybody knows about barley. No? It's rich in vitamins A and C, which act again as powerful antioxidant. Helps repair the body's cells, muscles, blood vessels, and bone marrow. Now, it also has a detoxifying effect, meaning it stimulates the kidneys to cleanse the body, and try to increase the elimination of urine. Yung urine output is very important. That's the reason why kapag ka may suspecha ka na something might be wrong in your kidneys, we need to test what we call the kidney function test. That is by determining yung creatinine level. The moment mataas yung creatinine, ibig sabihin, hindi nagpa-function yung ating kidneys properly. And then, of course, moringa. Ano ba yung moringa sa common layman's term natin? Malunggay. Hilig-hilig ko dyan kasi doon sa vacant lot ng katabi ng bahay ko, daming malunggay. So, yung aming kasambahay, inihahalo sa iba't ibang klase ng gulay o no. Wala naman siya lasa. Very good pa, di ba? So, moringa is very rich in healthy antioxidants and bioactive plant compounds. Very nutritious because it contains excellent source of vitamins and minerals as well as protein. It is also rich in antioxidants that will prevent what we call oxidative stress, associated with heart diseases, diabetes, and all these problems. Yung natawag na oxidative stress na nagre-result because of the proliferation of what we call free radicals. Kaya importante yan is maremedyohan natin through antioxidant preparations. And one good antioxidant is, of course, our uva ursi because of its content in moringa. It also helps lower blood sugar level and anti-inflammatory, reduces inflammation. Okay. So, it also helps lower cholesterol. Napaka-ganda kasi why? Lahat ng sakit ng tao ngayon ay tinatawag ng lifestyle diseases because it is brought about by poor lifestyle. So, diabetes, hypertension, the different forms of arthritis, heart diseases. And now, they're looking into cancer as a possible lifestyle disease. Obviously, hindi malayo kasi vices like smoking, excessive alcohol intake can definitely affect some major organs. Smoking, yung lungs natin. Sa excessive drinking, yung liver natin. Kaya nga may tinatawag na alcoholic fatty liver disease. Yun namang iba, sabihin, Doc, bakit may fatty liver ako? Hindi naman ako umiinom ng alak. Yun nga tinatawag na non-alcoholic fatty liver. Again, it's brought about by taking a lot of fatty foods. Lahat ano tawag dito? Yung fast food chains. Sabi naman ng iba na lagi ko sinasabi, Doc, bakit pa mahilig sila pinopromote pa nila yung mga masasamang pagkain? Negosyo yun eh. Cannot do anything about that. Now, kung ako yung may-ari, for example, ng isang fast food chain, tinanong sa akin ng mga customer, ba't yun nangyari? Masama yan. Hindi ko naman ho kayo pinipilit eh. Kung ayaw nyo, yung bilhin. Ngayon, kung gusto nyo, basta anong gusto ko para tumaas yung sales ko. Yun lang labanan. So, wala tayong laban doon. It all boils down to how we can be able to discipline ourselves. Okay? And then, of course, ayan, protect against arsenic toxicity. No? Kasi ang arsenic is a heavy metal that has been found to increase the risk of cancer and heart disease. Importante rin yan. So, yung rose hips, no, fruit of the rose may help reduce signs of aging. So, anti-aging. No? Sometimes they don't like to use the word anti-aging. Reverse aging na lang. Okay. Because sabi nga ng iba, you cannot help or you cannot stop the aging process. But we can do something in order to slow the development of aging. Yun naman yung point natin. So it lowers blood pressure, cholesterol, the pains, the inflammation, including the oxidative stress. Okay? So that's it for our Uva Ursi Plus. So thank you for your indulgence. Always remember to take Uva Ursi being a very powerful and very effective health supplement. Kanina, we've been talking about Uva Ursi Plus, no? Yung ganda niya, ano yung mga different ingredients. So consequently, na-associate natin bakit ganun yung mga health benefits niya. Because again, para din yan yung mga gamot na may mga combination, no? Meron tinatawag na monocomponent, like for example, paracetamol, yun lang yung ingredient niya. Pero meron din multi-component ingredients. Dito, sa ating supplement, this is multi-component. And the more na mas marami siyang component, mas maganda ang effect. Kasi nagtutulungan. Yun tinatawag nating synergistic effect. Nagtutulungan sila, mas lumalaki or mas, how do you call it? Napapalakas yung, yung strength ng ating product. No? Yun ang maganda sa Pilipino. All Filipinos are able to speak English. No? Well, for some, medyo mahirapan magsalita, pero naintindihan nila. Kasi kaya ho ako ganito because there was a time na ang medicine gusto sanang i-translate sa Tagalog. It's about more than perhaps about 30 years or more. Kaya lang, ang hirap. Gaya lang ng pag sinabi mong rheuma, may tatlong klase ng arthritis, osteoarthritis, gout arthritis, rheumatoid arthritis. So, paano mo di-differentiate pag tinagalog mo? So, hindi rin pwede, no? Marami pa. That's the reason why, well, we try our very best to do it Taglish. Kaya lang kasi dahil yung ating anong tawag dito, medium of instruction is nasanay na tayo sa English. Mas madaling ipaliwanag sa English. I know and I sincerely believe that everyone understands what I'm talking about. Okay? So let's proceed. So glutathione, one of the most controversial products, no? Kasi lagi na lang iniisip ng tao, glutathione, pampaputi yan. Gusto ko yan. Actually, yung whitening effect ng glutathione is more of its good side effect. Ito lang yung pwede natin sabihin na, meron palang mga good side effect. Not all side effects are bad. No? Now, glutathione is the body's most important antioxidant. In fact, it is now referred to as mother of all antioxidants. In some articles, they would call glutathione as master antioxidant. It's a molecule made up of 3 amino acids, L-cysteine, glycine, and glutamic acid. Given na yan. Pag siya mong glutathione, yung tatlong yan, L-cysteine, glycine, and glutamic acid. Now, being a powerful antioxidant, no, it is very crucial for what we call cellular detoxification. No? Again, ina-associate natin ang glutathione sa liver because it is the liver that produces the natural glutathione. The only problem is bakit kailangan natin mag-supplement pa ng glutathione? Simply because hindi sapat yung napoproduce ng liver na glutathione. So, kailangan natin dagdagan yung amount ng glutathione. Para na sa ganun, ma-maximize natin and ma-optimize yung magandang benefits ng glutathione. Okay. That's the reason why it was stated there. Liver health, naturally. Because yung liver ang numero unong internal organ that is involved in the synthesis or what we call the production of glutathione. Heavy metal transportation. Yan. Tinatransport niya yung heavy metals para makalabas sa ating katawan. So, meron tinatawag na fat-soluble and water-soluble toxins. So, yung fat-soluble, no, kino-convert niya into water-soluble para dalhin yung water-soluble toxins sa kidneys. And from the kidneys, ilalabas natin sa katawan natin through urination. Okay? So, yun ang purpose nun. Kaya importante pa rin. Very, very crucial ang kidneys natin. Kaya kailangan masupplyan na natin ng glutathione. Hindi porke uminom ka ng glutathione, expectin mo puputi ka kagad. In fact, I don't usually mention it as such. Kung mangyari, good. Kung hindi mangyari, well, that's not the purpose of taking glutathione. Okay? So it will protect us from oxidative stress. So, antioxidants are needed in the body to protect cell integrity and to fight free radicals. And consequently, of course, yung tinatawag na oxidative damage or oxidative stress. No? It's a powerful detoxifying supplement. So, tinatanggal niya, removes the toxins, and eliminates poisons, no? Namely, in the liver, the lungs, the intestines, and the kidneys. So, kung titingnan natin, yan yung mga ilang major internal organs na dapat nalilinis. No? Sabi nga namin, malimit, a good and effective health enhancement should always start with detoxification. Kailangan malinis muna natin yung gaya din yan pag naliligo tayo. Ano ba purpose ng naliligo tayo? Para linisin yung katawan natin. Pero the only problem is kahit naliligo tayo is external lang. What about the internal organs na napakahalaga sa katawan natin? Because doon nakasalalay yung ating buhay. Kailangan din linisin natin. That's the reason why detox is now getting to be a byword. Siya na lagi pinag-uusapan, detoxification, detox. And we have 7 areas of elimination. So, hindi lang sa dumi, colon, di ba? You have the kidneys for urination. You have the skin. Kaya nga pag nagsisweat, no? Nai-eliminate din yung ibang toxins through sweating. No? You have the lungs. Kasi nag-inhale, exhale. The moment we exhale the carbon dioxide, hindi kailangan ng katawan natin yun. So that's also a detoxifying organ. Ano pa? Yung ating liver, powerful, detoxifying organ. So siya nga yung, we call it sieve. Siyang nagsasala ng lahat ng pumapasok sa katawan natin, no? Through the food that we eat, through the liquid that we drink, no? Not only water, lahat siya sinasala ng liver. Tinatanggal niya agad-agad yung ibang toxins. But because of the overwhelming amount of toxins, meaning sa sobrang dami ng toxins na dapat niyang tanggalin, minsan hindi na niya nakakaya. That's the reason why we need to support the liver. And by taking a glutathione preparation, what happens? No? Natutulungan natin siya in its detoxifying process. Okay? At the same time, the conjugation of glutathione, ibig sabihin, the combination. The moment the glutathione combines with the toxins, no, tatanggalin niya to sa ating katawan. Okay? So, sabi ko nga kanina, bakit pa kailangan ng supplement like glutathione? Kasi, minsan hindi na kaya na sarili nating katawan. So, we need to add things that will help not detoxify our bodies. And that is through the use of glutathione. Okay? Most critical and integral part of any detoxification system. Okay? So, anong nangyayari niyan? The moment there is a good amount of glutathione inside our body, whether it's becoming from the liver or from exogenous sources, meaning yung iniinom natin, what happens? No? Nagagawa ng gusto. The toxins will stick onto the glutathione and then dadali ng glutathione yan either through the gastrointestinal tract para nilabas natin through the stool, so dumi, or through the kidneys and ilalabas natin naman yon through the urine. Okay? Now, nakita sa mga some studies, no, the expected effect of a 4-week, meaning 1 month of oral intake of glutathione, which is 1 gram, meaning 500 milligrams. No, in clinical trials, included the following: it increases energy levels, it increases or elevates the immune system, and it allows better metabolic function. So, napakaganda. 1 month pa lang yan. And what about kung if you're taking it for 1 year, 2 years? Remember that supplements can be taken for a much longer period of time. You don't need to worry. Dok, masama, baka magkaroon ng side effect. No, absolutely not. Mas maganda yung habang tumatagal yung iniinom natin because it will provide the necessary amount of that particular supplement para na sa ganun ma-enhance yung overall health natin. Okay? Si Dr. Mark Hyman, I follow him Kasi ano yan, sikat. He even said that the most important molecule that you need in order to stay healthy and prevent aging, cancer, health disease, dementia, and more, and necessary to treat everything from autism to Alzheimer's disease is glutathione. So that's how powerful glutathione is. No, it binds, it mixes with harmful chemicals, heavy metals, and other toxins, and carries them into the bile through the stool where they are excreted. Sabi nga natin, would be sa dumi or sa ating ihi. So what are the health benefits of glutathione? It supports healthy inflammatory processes. So meron tinatawag na healthy because it blocks the inflammatory, what we call cytokines. Yung cytokines, naging popular siya during the pandemic. Kasi yung tinatawag na cytokine storm, no, kung saan nagwawala na yung internal milieu, yung internal environment ng katawan natin. To the point na yun, nadi-disgrace. Maraming disgrasyang mga pasyente because of cytokine storm tinatawag, because of COVID-19. No? So, this glutathione will block this production of the cytokines from being formed to support a balanced and healthy inflammatory response. Another one would be supports healthy detoxification. Sabihan natin. Supports the body's natural detoxification pathways which aim to reduce oxidative stress, or sometimes called oxidative environment, no, and damage from free radicals. Okay? Ano pa? It supports cognitive and mental health. Pag sinabi cognitive, yung ating kaisipan, no? Sufficient levels of glutathione will support a healthy mood and positive response to stress. So, automatically, it helps in managing stress. Kasi we cannot do away with stress. Andiyan na yan eh. No, hindi mo pwede sabihin, Dok, pwede ba akong mawala ng stress? No. Absolutely not. Lahat ng tao, whatever profession you are in, whatever economic status in life you are in, no, yung stress is part and parcel of our daily living. What matters is how can we manage the stress level. No? So yan ang mas mahalaga ang dapat pag-usapan. And one of that is of course by taking supplements like glutathione. No? Can support healthy memory ability and healthy cognitive function in order to prevent Alzheimer's disease. May Alzheimer's, senile dementia. Habang tumatanda tayo, nakakalimutan na natin lahat. Yung iba, merong intentional Alzheimer's. Nakakalimutan nila yung utang nila. Yun lang, yung nakakalimutan nila. All the rest, nila nakakalimutan. So, that's not Alzheimer's disease. Okay? So, gusto natin, kaya nga, di ba kanina, in the beginning, I was telling you something about longevity, paghaba ng buhay ng tao. Simply because, ang labanan, yun ang pahabaan. Pero we make sure that productive tayo. Hindi naman yung bedridden tayo 10 taon na. Siguro naman, pwede na tayo mamaalam. Pero if we're very productive, like a lot of people that we know, tatanda na 90, ang ganyan, no? Very productive pa. Yung utak nila, parang utak lang natin. Okay yun, di ba? And that is very important. Another important, aside from cognition, no, yung cognitive ability natin, is, of course, the gut health. Pag gut, G-U-T, that refers to the gastrointestinal tract. Okay? So, one of the most crucial barriers in the body that protects the body from receiving unwanted or dangerous particles. Okay? So, pagka meron kasi tinatawag na leaky gut syndrome, kung saan lumalabas na. Mahina na yung lining ng ating gastrointestinal tract. So much so na naghahalo-halo na yung mga hindi dapat maghalo. So, by taking glutathione, that will help prevent the mixing of these different, sabihin lang natin, environmental milieu. Yung tinatawag na gut microbiome natin para hindi siya ma-compromise. And glutathione supports the body's natural healing and renewal in gut lining cells. So, pinatitibay niya yung support. Also, supports healthy immune response. Ang pakalaga nun. Again, gaya yung pinag-usapan natin kanina, it has to increase the immune system of the body in order to defend the body from all these opportunistic microorganisms and toxins na pwedeng pumasok sa katawan natin and will cause a lot of medical concerns and conditions. Supports liver and kidney health. Naturally, sabi natin, ang pinaka-numero unong purpose ng glutathione is to help the liver in its detoxifying property, para ma-maximize, ma-optimize yung the removal of toxins from the body through the help of the liver. Works to support the liver by neutralizing oxidative toxins that will cause damage to any particular organ. Okay. The liver can even make its own glutathione. Yung sinasabi natin. Yung natural, the liver. So, importante na maayos yung estado ng liver natin. Otherwise, kung meron tayong fatty liver, meron tayong fibrosis of the liver, that may end up getting into liver cirrhosis, and finally, liver failure, wala, hindi na natin kakayanin. Tawan natin. And remember that the liver is a very, very important organ. So yan, makikita natin, glutathione supports the immune system. It contains cancer-fighting properties, it controls inflammation. It is considered a master antioxidant. Research has shown that an elevated glutathione level decrease muscle damage, reduce recovery time, no, increase strength and endurance, and shift metabolism from fat production to muscle development. Ano ibig sabihin? Yung taba is converted into muscle. No? So, we are able to change the status from, say, obesity or overweight to normal body or ideal weight. No? Na, sabihin nila, Doc, bakit mabigat ako kahit wala na akong halos taba? Remember, the muscles are also quite heavy. So, kung ikaw ay muscular individual, kahit na halos wala kang taba, maano ka pa rin, ang timbang mo pa rin mabigat. Pero, at least, maganda because you're able to eliminate all these fats inside the body. That will definitely cause problems, lalo na sa cardiovascular health. So, it's a combination of 3 simple building blocks of amino acids. Sabi nga natin, cysteine, glycine, and glutamine or glutamic acid. Produced naturally in the body through the liver. It is called the master antioxidant because it can generate itself in the liver after its fill up of free radicals. Tuloy-tuloy yung free radicals production eh. So, minsan na halos matalo na yung liver natin. But because of constant supply of glutathione through glutathione supplements na nare-reverse natin. So, mananalo pa rin yung liver natin in order to eliminate the free radicals na meron tayo. Because we cannot do away with the free radicals because these are usually the byproduct of normal cellular metabolic oxidation. Kaya lang, it also results to toxic overload. Sumusobra ng dami ng ating toxins sa katawan. And that can also lead to what we call autoimmune diseases. No? Several types of cancer and even heart attacks. Okay? So, sabi nga ni Dr. Hyman, yan yung sinasabi natin, mother of all antioxidants because it includes people with chronic fatigue syndrome, heart disease, cancer, chronic infection, autoimmune disease, diabetes, autism, Alzheimer's disease, Parkinson's, arthritis, asthma, kidney problems, liver disease, and more. So, halos lahat na lang nandudod. So, we need talagang kailangan natin ng glutathione sa katawan natin. Now, another important, sabihin natin, component, hindi na to glutathione. NAC, the N-acetyl-L-cysteine. This is a supplement din, meron tayo, hindi ko lang natin dala yan. It is a form of N-acetyl-L-cysteine or NAC. Malimit na natin na yan. The body makes this into cysteine kasi yung among the 3, do sa cysteine, glycine, and glutamic acid na ingredients ng glutathione, it's the L-cysteine that is the most important. No? And ito ang nagbibigay daan to increase the production of glutathione. Okay? So, again, antioxidants fight free radicals that damage cell membranes and DNA. The researchers think free radicals play a role in the aging process. Kaya pagka na-neutralize natin or na-eliminate natin majority of the free radicals, then what happens? That will help prevent us from aging faster. Okay, so parang anti-aging property yun. Reverse aging ang gusto natin mangyari. Because that would also help in trying to prevent serious complications like heart diseases and cancer. N-acetylcysteine may be used in preventing or treating the following angina. Angina is chest pain. Maraming pasyente, Doc, bakit hinahapo na ako yung SOB, shortness of breath, tapos sumasakit yung dibdib ko. Yung iba ang interpretation, Doc, magpapalpitations ako. Kasi minsan naramdaman mo kumakabog yung puso mo, naging irregular. No? Pero pagka sumasakit na, lalo na yung ang description parang squeezing pain, parang pinipila na gano'n. That is what you call angina. The moment you suffer from that, it means that you have some problems in your heart, sa puso. And then chronic bronchitis and yun, COPD, chronic obstructive pulmonary disease. Influenza, which is a viral infection. Acute respiratory distress syndrome. And yung mga HIV AIDS patient, no, pwede matulungan. Yeah. Kasi yung iba sabihin, may AIDS ka na, hopeless ka na. Hindi naman. For as long as na monitor yung individual with AIDS, no, at nabibigyan ng sufficient, appropriate, no, and effective supplements, pwede makarecover. Might only take time. Pero the point is, it's not a hopeless case. Reducing symptoms associated with, well, Sjogren's syndrome is autoimmune naman siya. No? Reduce symptoms of asthma, no, that can possibly cause emphysema and cystic fibrosis, colon cancer prevention, no, helps increase fertility, no, especially yung sinasabi natin with PCOS, polycystic ovary syndrome. Lately, probably for the past less than 10 years, ang dami-daming kababaihan na may PCOS. Kung gusto nila mabuntis, hindi sila basta-basta mabuntis. Simply because of maraming cysts on the ovaries. No? Kaya kailangan maayos natin. Kung doon sa iba napakadaling mabuntis, meron namang mga grupo ng babae na ang hirap mabuntis. No, gusto na mabuntis pero hindi. So, again, ano yun damay-damay. So, we make sure that we're able to monitor lahat ng nangyayari sa loob ng katawan natin and be a bit conscious about our weight. Kasi isa sa mga problema is overweight and obesity. Helping treat schizophrenia. Noong pandemic, ang taas ng incidence ng depression, taas ng incidence ng anxiety reaction. Obviously, apektado yung economic situation ng lahat ng pamilya because of natigil sa trabaho, nalugi sa business, and all of those things. That's the reason why mabuti na lang nakaka-recover na tayo because we're getting back into normalcy. Okay? Pero siyempre, kailangan matutukan pa rin. Now, it also reduces lung cancer risk, especially among smokers. Yan yung mahirap minsan Payo tayo ng payo, bigay tayo ng bigay ng mga supplements, pero yung mga vices ng iba nating mga kliyente, hindi nila ma-stop. So how can we remedy the situation? So it's either they give up, no? They should realize the impact of all these vices. Hindi maganda sa katawan. So kung hindi rin nila ititigil, and magtitake pa rin sila ng supplement, that will not help, definitely. Kailangan lahat yan. Kaya nga, di ba, we usually talk about holistic approach, meaning the nutrition, the physical activities, and of course, the supplements. Kailangan balansyado. No? We do away with all these vices kasi wala namang maitutulong sila sa kalusugan natin. In fact, they are making it even more serious. And then, help control blood sugar. The only factor na wala tayong magagawa is the genetic factors. So, kung very strong, mapapansin nyo, pagka kukonsulta kayo sa doktor nyo, ano bang history sa pamilya? Meron bang may nagkaroon ng cancer? Meron bang may hika? Meron kung ano. Because it increases the predisposition. Ang ibig sabihin predisposition, the possibility of you developing the same problem. But it's not automatic. Sometimes it skips generation. One generation, magmamanifest sa susunod generation. Or, at all, hindi rin siya magkakaroon ng effect sa katawan mo. So, the only thing that will matter is that comparing you na meron kang tatay na nagka-cancer, nanay na nagka-cancer, tiyo, compared to someone na walang history, mas malaki yung chance mo na magkaroon. Pero it's not something automatic. Okay? So, yun yung that's the reason why getting into the family history is very important. And then, of course, collagen. Sabi nga, vitamin C, collagen, glutathione, is a very good combination. Kasi ang collagen, yan tinatawag nating structural matrix. Para kung saan ang semento. Siya ang nagpapatibay ng ating mga parte ng katawan para hindi magkalasog-lasog. Di ba? Without enough collagen, ang masakit, at the age of 30, nandoon na yung peak ng collagen production. Ibig sabihin, kung i-quantitate natin 100% at age 30. Every year thereafter, habang tumatanda ka, between 1.5 to 2% ang mababawas na collagen. So you can just imagine when you're 50 years old, how much of your collagen content is nawawala na. As you go older, kumukonti yung collagen. Importante yan. That's the reason why, again, we supplement. Kailangan pataasin uli natin. Despite the age, no, na alam natin na nababawasan, kailangan i-replace natin. And that's the reason why we have some collagen supplementation. It is found in connective tissues, skin, tendons, bones, and cartilage. So, yung minsan, di ba, nagdo-double chin na tayo. No? Lumuloy-loy na yung braso natin. No? Simply because of collagen. Kulang na yung collagen. That's the reason why we need to take in collagen. It provides the structural support to tissues and plays important roles in cellular processes, tissue repair, immune response, cellular communication, and cellular migration. Okay? A process necessary for tissue maintenance. So, yan, yung tinatawag na fibroblast, no? Yung connective tissue cells that produce and maintain collagen. As people grow older, their collagen becomes fragmented, fibroblast function becomes impaired, and collagen production slows down. In fact, halos wala na tayo napuproduce eh. Nababawasan pa ng gusto. That's the reason why we need to supplement. We need to add. Kailangan madagdagan yung ating collagen sa ating katawan. No? This changes, along with the loss of another structure called yung elastin, leads to signs of aging such as sagging skin and wrinkles. So to avoid that, no, para mas mag-stretch yung ating balat, no, especially in the face and in other areas, para maging wrinkle-free, well, dapat masustain natin yung mataas nila ng collagen. Okay? Cigarette smoking has been found to degrade collagen. That's the reason why mas malimit, especially for chronic smokers, mas mukha silang matanda because of the wrinkles and all those. And the loss of elasticity. Naninigas na, nawala na yung flexibility sa ating skin. Excessive alcohol drinking has also been shown to accelerate skin aging. Importante pa naman sa atin, magmukha tayong bata. Diba? So, additionally, following a diet high in added sugar and ultra-processed foods can lead to premature aging. Nakita nga nila ngayon ng studies na the moment you have a deficiency in collagen, no, this will definitely result in premature aging. Lalo pa kung mahilig ka sa sugar. In fact, sugar now is being seen as one that will stimulate cancer cells. Gustong-gusto na kinakain ng cancer cells ang sugar. So, mas kung on equal footing, titingnan mo, yung mahilig sa matatamis, mas mataas ang tendency magkaroon ng cancer rather than those. So, tayo, again, we have to discipline our taste. Yun lang naman ang problema natin. Hinahanap natin, gusto natin ito. Pero pag dinisiplina natin, nasanay na tayo, hindi na natin nahanapin. Okay? So, makes a lot of sense. Excessive sun exposure will definitely degrade collagen production. So, wearing sunscreen, avoiding excessive sun exposure, this will all prevent signs of premature skin aging. Okay? Hindi na natin ano yung mga Of course, importante yung mga kinakain, no? But just the same, no? Again, sabi ko nga kanina, vitamin C, glutathione, collagen. This is a very common combination, no? Na binibigay natin sa ating mga pasyente. No? But what's more, consuming a diet high in beneficial plant compounds would also help improve skin health. Yan yung tinatawag natin phytonutrients. When you say phyto, plant-based. There's nothing greater than plant-based supplements. No? Yung galing sa mga halaman. No? That's the reason why we try to avoid it. So, with that, again, thank you very much. I hope you were able to learn some good things about our precious products. So, until then, let's see you again next time. Bye.